Welcome, Dr. Foxwell. Thank you for joining us today. Dr. Foxwell is a cardiologist for Novant Health Heart and Vascular Institute. So let's start off. Just tell me a little bit about your background, how long you've been here in the area, and what brought you here.
Yeah, so I've been here since August of last year, so a little less than a year. Came down, I'm from Michigan, so a little better weather down here. Get to enjoy the beach, and thought it'd be a good place to work.
Awesome. Well, we're glad to have you here. So tell me, do you see patients in Wilmington, or do you also see patients in Brunswick County?
Yeah, so I'm actually 50-50, so I'm 50% of the time I'll be at the Wilmington location, and then 50% of the time I'll be in Brunswick.
Okay, and that location for Brunswick, is that the building beside the hospital?
Yep.
Okay, perfect. So we are here, we're talking about February Heart Month awareness. So we wanted to just talk a little bit about heart attack symptoms and just kind of to raise awareness. So what are some of those classic symptoms that you see for patients that are experiencing heart attacks?
Yeah, so what I always tend to tell my patients is, first of all, anything that's abnormal for you is something that we should be looking into. Mm-hmm. But more specifically than anything, it would be if we're having pain that's associated with any kind of exertion that goes away with rest. And the reason why I say pain and not chest pain necessarily is some people don't actually have chest pain. It'll be maybe just jaw pain or pain down one arm that they'll have. But the biggest thing that we look for is it getting worse when you are exerting yourself, and it gets better when you rest.
What about for women? Like, do you think, I know sometimes it seems like symptoms for women can be a little bit different from men. So can you talk a little bit more about that?
Yeah, so for my female patients, I always tell them that they should really more so be on the lookout of things that are abnormal. And specifically when I say this would be like you're having indigestion that's not going away when you take Tums or anything over the counter. You're having maybe, again, sometimes I've had a patient that just has jaw pain when she has her heart attack symptom, or just pain in one arm, or even just kind of a pain that's maybe below your diaphragm here. Just anything that's abnormal for you that's not going away should be concerning, especially if you have certain conditions that would make you a little bit more risk.
Okay, great. And what should someone do if they're experiencing any of these symptoms?
Yeah, so I always tell my patients, depending on how serious it is, if it's not going away, first and foremost, call 911 and go to the emergency department. Now, if you think it's something that maybe can wait, you could always go to an urgent care or your primary care doctor. Mm-hmm. They can determine if they think you need emergency care or do you need to see a cardiologist. But you're never going to be wrong to go to the emergency department and at least get checked out.
And what are some tips that you can give everybody just to make sure that they're thinking about heart healthy things? What would you tell your patients?
Yeah, so I always tell them, obviously, healthy lifestyle in general is going to be the best way to live a long life. So number one thing is exercise. I always recommend to get 150 minutes of exercise per week. I know that's a lot, so I always tell them, let's work up to that. If you haven't been exercising much and you go all of a sudden to 150 minutes, you're never going to maintain it. So I say let's start with 10 minutes a day. Something simple, but we want to get your heart rate up. So that's, brisk walk to maybe a jog, or just some sort of aerobic exercise, water aerobics, anything that will get your heart rate elevated. And then the other thing is, diet, which is also a very important part of being heart healthy. So one of the diets we recommend is Mediterranean diet or something called the DASH diet. So Mediterranean diet, I feel most people have probably heard of at this point. It's kind of what I call the common sense diet.
Right.
You're just kind of lean proteins, so fish, chicken, turkey, and then whole grains. You're going for olive oil for your saturated your fats, so you're trying to cut out butter and margarine and all of those things. And then DASH diet's actually specifically for our patients that also have hypertension, and that's more so as just a focus of low sodium, trying to cut back on the sodium in your diet. Which is easier said than done, because if you actually look at the labels, many things have salt in them that we aren't actually aware of. So that's why I always tell patients to be mindful. It's more than just not putting salt on your food itself. It's going to be also reading the labels.
Yeah, all those processed foods and tricky.
Yep. Yeah.
Perfect. Well, is there anything else that you would like to add? Any other tips that you would like to share with our viewers?
I just tell people, at the end of the day, you can make a change in your life at any time, and all it takes is just one small change, and then you can build on that over time. So you can't do everything at once. Pick one thing that you want to change, whatever that is, and then work off of that.
Awesome. Well, those are some great tips. We really appreciate you taking the time to be with us today, and enjoy the rest of your day.
Thank you.